So our first presentation will be by Dr. Sandeep Sahany from the Centre for Climate Research Singapore, or CCRS in short. Dr. Sahany leads the Climate Projections and Extremes branch at CCRS. His team of research scientists were responsible for delivering a major part of Singapore's third National Climate Change Study, V3. Using the latest projections from V3, Dr. Sahany will be giving an overview of how extreme temperatures in Southeast Asia will be changing over the next few decades. Dr. Sahany, please.
Thanks, Trina. Good afternoon, ladies and gentlemen. Today I'll be presenting to you a regional overview of projected changes in extreme temperatures across Southeast Asia from Singapore's third National Climate Change Study, or V3 as we call it. Aurel mentioned about it earlier today. So, while what I will present in the next 20 minutes or so could be alarming, the purpose is to inform you so that we can push for necessary actions while we still have some time before it is too late. Parched farms cancel classes, extreme heat scorches Southeast Asia, said one of the headlines in Straits Times earlier this year, one of the leading newspapers in Singapore. Picture on the right shows a 7-year-old sweating even while doing his homework at home in Quezon City near the Philippine capital Manila on 2nd of April. Back home in Singapore, where we are blessed to have quite a lot of air conditioning, still, several schools eased uniform regulations in late March to allow students to dress in their physical education attire. And I'm not even talking about the outdoor workers, elderly, and other vulnerable sections of the society suffering immensely due to intense heat. So, how does the future look like? This is a headline from one of the leading newspapers in Singapore based on V3 projections. By 2050, today's extreme annual temperatures may become the daily norm in Singapore. And this is not very different from other ASEAN countries. The story is more or less the same. Rising temperatures around the world. Temperatures around the world have been rising because of anthropogenic climate change. Based on the most recent WMO State of the Global Climate Report, the global annual mean near surface temperature in 2023 was around 1.45 degrees Celsius above the pre-industrial average. The year 2023 was the warmest year on record, and the last 9 years, 2015 to 2023, were the 9 warmest years, or rather hottest years on record. Based on the recently released WMO State of the Climate in Southwest Pacific report, the annual mean surface temperature averaged over both land and ocean areas in 2023 in the Southwest Pacific region ranked between the first and third warmest on record, depending on the data set considered. 2023 was substantially warmer than the previous several years in the region, largely as a result of the transition from La Nina to El Nino conditions. Rising temperatures in Southeast Asia as well. Back home in Southeast Asia, the temperature story is no different, as is evident from the warming stripes shown for various Southeast Asian countries using data from Berkeley Earth and Era 5 Land. These are the warming stripes figures many of you would have seen. It shows the warming stripes for 9 out of 10 Southeast Asian countries, and we can see how the blue has been fast moving into red and darker shades of red. Singapore's National Climate Change Study V3, which Aurel talked about earlier today, as mentioned, that was released earlier this year, provides the latest and highest resolution climate change projections for Singapore and the Southeast Asia region under 3 global warming scenarios: SSP 126, SSP 245, and SSP 585, the low, medium, and high emissions scenario respectively. This schematic shows the probability distribution of temperature under present and future climates. The black curve represents the current climate, and the gray dashed curve represents the future climate. The future climate is shown as a combination of change in the shape of the distribution and a shift to the right, leading to more hot days, more hot extremes, and occurrence of both unprecedented hot as well as cold events, especially the hotter ones. The left panel in this figure, so this is from V3 projections. It shows the daily maximum temperature. The left panel shows a time series of historical and projected daily maximum temperature averaged over Southeast Asia for March, April, May, the hottest months of the year, under 3 SSP scenarios. And on the right, we have end century projections under the 3 scenarios. While under the low emissions scenario, the projected change is less than 2 degrees Celsius. Under the high emissions scenario, the projected change is up to 4.5 degrees Celsius. This is a spatial map of the daily maximum temperature. The left panel shows a map of the ensemble mean daily maximum temperature change during the last decade of this century, that is 2090 to 2099, under the highest emission scenario, that is SSP 5.8.5. And on the right panel shows the corresponding Southeast Asia average change for each of the decades, starting from 2020 to 2090, the decade of 2090. What we see here, while averaged over the domain, the change is close to 4 degrees Celsius. Many land points, as can be seen on the left map, show a change of close to 5 degrees Celsius. This would have a significant impact on outdoor activity. And please remember that these are all 10-year means, and you can add the variability. So a given year could be even higher than what we show here. So the days are hot. Can we at least sleep well in the night? The answer is probably not. The left panel shows a time series of historical and projected daily minimum temperature averaged over Southeast Asia for March, April, May under 3 SSP scenarios. And on the right, we have end century projections under the 3 scenarios. While under the low emissions scenario, the projected change is up to around 2 degrees Celsius. Under the high emissions scenario, the projected change is up to around 4.7 degrees Celsius. And not having a good night's sleep leads to what, the health implications. Professor Jason Lee will tell you more about it when he speaks. The left panel here, again, this is a map similar to daily max temperature. We also show the daily minimum temperature. The left panel shows a map of the ensemble mean daily minimum temperature change during the last decade of the century for the months of March, April, May under the high emission scenario. And the right panel shows the corresponding Southeast Asia average change for each of the decades. While average over the domain, the change is close to 4 degrees Celsius. Many land points, as you can see from the red hotspots from the map, many land points show a change of close to 5 degrees Celsius. Next, we move on to a metric called as wet bulb globe temperature, which is used for heat stress. It helps identifying environmental conditions that could lead to heat stress, and hence implementing protective controls to prevent heat-related injuries. Adopted by the US Army in 1950s and US Occupational Safety and Health Administration, it is mainly used in military, sports, occupational, and public health sectors. It not only takes into account the air temperature, but also relative humidity, wind speed, and solar radiation. So it's a metric which tells us how a human would feel in terms of heat stress under various temperature, humidity, winds, and solar radiation. The top row here, so this is from V3 projections. So as Oral briefly mentioned earlier today, the WBGT is not a direct model output. We have to use the climate variables offline to run an energy balance model and compute WBGT. So the top row here shows the projected change in WBGT during mid-century under the 3 emissions scenarios, that is the SSP 126, 245, and 585. And the bottom row shows the same, but for end century, that is 2080 to 2099. What we see here is, as expected, end century changes are higher than mid-century changes, and the projected changes increase with emissions. If we zoom into end century changes under the high emissions scenario, the projected changes are in the range of 3 to 5 degrees Celsius, with higher values over Indochina towards the north, if you see. Again, all this are mean values. If you take into the year-to-year variability, it could be much higher. Now this figure shows WBGT changes averaged over 9 ASEAN countries for the mid and end centuries under the 3 emissions scenarios, and the changes are higher with higher emissions as expected, especially during end century. For example, if we zoom into one of the countries, say Vietnam, the country average projected change is up to 4 degrees Celsius by end century under the high emissions scenario. Now this is for Singapore. We're switching gear a bit. We are looking at observations now. Singapore has 9 WBGT sensors spread across the island. The left panel shows the observed hourly maximum WBGT across the year from one of the stations in Singapore using 6 years of data. That's 2018 to 2023. So around 2018 is when we started the WBGT measurements in Singapore. It shows the occurrence of higher WBGT during the months of April, May, with daily maximum occurring during 12 to 3 p.m., when generally people go out for lunch or when kids are returning from school and so on. So the exposure could be really high. On the right is the heat stress advisory, which Oral also showed earlier today, from Singapore's National Environment Agency, released last year, which categorizes the WBGT into low, medium, and high heat stress categories, and also suggests appropriate activities, actions, and attires which people should do based on the category of heat stress. V3 projections of heat stress days for Singapore. So with the categorization of moderate and high heat stress days based on NEA's heat stress advisory, we projected the future moderate and high heat stress days for Singapore under the 3 SSP scenarios. And we find that under the high emissions scenario, there could be up to 300 plus days of high heat stress every year. Or to put it in simple words, almost every day could be a high heat stress day. Well, while it may appear all doom and gloom, the reality is that we have a choice. So these are projections under various scenarios, but we have a choice. And we need to act. It's not about just choosing something in your mind and not doing anything. It's choosing and doing something about it. In response to the rapid rise in the scale, intensity, frequency, and duration of extreme heat, UN Secretary General Mr. Antonio Guterres on 25th of July earlier this year called for an urgent and concerted effort to enhance international cooperation to address extreme heat in 4 critical areas: caring for the vulnerable, protecting workers, boosting resilience of economies and societies using data and science, and limiting temperature rise to 1.5 degrees Celsius. I know which we are very close to, dangerously close to, by phasing out fossil fuels and scaling up investments in renewable energy. With this, I end, and thank you for your attention.
Thank you, Sandeep. So we'll now open up the floor for questions. Do not feel shy to approach the mics. In the room for any questions? If not, we have a question online on Pigeonhole. The question is behind you, Sandeep. If you have a plan, domain extend, I'm assuming if I plan to extend the domain, because the northern part of Myanmar cannot participate in your projection. Okay, so I think this person is asking if there's a plan to extend the domain.
We are sorry about that. We were mindful when we did the runs, but we could only include the southern part of Myanmar and not the northern part because of the orography in the northern part, which led to instability in our model simulations. So we had to stop around mid-Myanmar and not the northern part. So we don't have plans to extend it further as of now, but the new Codex Southeast Asia domain will include northern Myanmar as well. So yeah, that would be an alternate source of climate change projections data. Yeah, thanks.
Okay, thank you. Thank you, Sandeep, for your amazing talk. Next up, we have Associate Professor Jason Lee from the National University of Singapore, NUS. Professor Lee co-leads the Human Potential Translational Research Program and directs the Heat Resilience and Performance Center in NUS. He'll be sharing with us about how climate change will impact human health in Southeast Asia. Professor Lee, please.
Testing 1, 2, 3. Okay, you had a good lunch, yeah? So this is the time I was looking at the back. Now some of you are feeling very lethargic. This is not your fault. It's physiology. Okay, I'm a physiologist, so I give you some tip. Yeah, so lunch can be detrimental if you have a requirement to stay focused. So this is the trick. What is happening right now is the insulin is still being secreted, trying to pack the sugar that you just consumed, right? So there are two things you can do. One, you can stand out and do 20 star jump with me, or push up. No? Okay, the second alternative, find something very sharp. Okay, and look at your neighbor. Now if they are falling asleep, just give a big poke by the side. Then this thing called adrenaline will be released, and you will suppress insulin. Then your blood glucose level will be maintained well. Okay, so that is the trick for you. I will talk about the impact on human health productivity. So that will be the focus. But before that, let me play. I prepared a few videos, but I'm mindful of time. I might skip one or two. We pay a bit for the videos, so my bosses say each time you have the opportunity, abuse the videos. So we'll play one. This one is a real incident, but reenactment. It happens in Bali. A couple almost got killed.
A heat wave is spreading across Southeast Asia as temperatures in Thailand reach 47 degrees.
It is hot. Earth's average temperature in 2023 was the warmest on record. Climate change is making heat waves longer and more intense. One of the worst side effects of the warming world is heat stroke. It can strike anyone, anywhere, like these two hikers, whose day of adventure quickly turned critical as the sun climbed higher.
When your body overheats and can't cool down, it can damage your brain, heart, kidney, and muscles. The invisible nature of heat waves means we do not realize we are facing heat stress until it is too late.
Symptoms like dizziness, muscle cramps, and extreme fatigue can escalate quickly, leading to serious dehydration and heat exhaustion. As their condition worsened, their only hope was a rapid rescue. The hikers faced the harsh consequences of their ordeal. What happened to them could happen to you and I. But why is our Earth getting hotter? Our atmosphere acts like a blanket, trapping the sun's warmth. However, human activity has made this blanket thicker, trapping more and more heat. The result? Extreme weather events are happening more often. Everyone is at risk, especially pregnant women, children, and the elderly. What can we do to prevent heat illness? Let's start with making sure you stay cool in the heat. Drink water or other fluids at regular intervals. On hot days, stay in the shade if you can. Find a cooler spot to rest. Reach out to your neighbors. Check on them. Share what you know. If you're experiencing dizziness, nausea, red, dry, or damp skin, headache, or fainting, you need to seek urgent care. Heat stroke can humble the fittest among us. Beat the heat and secure your safety.
This is good, but this is also not so good. This is exactly the response why for the longest time we, the Southeast Asians, don't think heat is a real issue. Because look at this, you talk about exertional heat stroke, look around, hard stats says we hardly have any exertional heat stroke death. And maybe because we are tropical natives, maybe because we can deal with heat so well, we must be physiologically a bit more acclimatized. That is totally untrue, right? I'm not sure about the rest of Southeast Asia, but I'm sure in Singapore, we do have data to show most human beings that reside in Singapore stay most of their time indoors. So we are very behaviorally heat acclimatized. We know how to escape from the heat. And that itself has a lot of negative implications, some of which I will show. So the video is good. It showed the classical implication of heat. There was a question asked earlier, what must we do to trigger more actions? We cannot pin the implications of heat in our context just to mortality. If not, you will conclude no death means no problem. Second message, I use this video is because you can see at the end it's sponsored by an insurance company. So think about the concept that maybe we need to insure people against extreme heat. Maybe that Grab deliverer who's going to deliver food to you on a hot day will need to deliver less, not 6 orders per hour, maybe 4, but you will pay the premium because you are the customer, right? You ask him or her to take the risk on your behalf on the raining day, on the stormy day, or the very hot day. Also, we need a whole of society approach to tackle this. Not just the maths, not just the physiology, not just the sociology, the whole society, different sectors must see how we can contribute our parts to hack this wicked issue. UN Secretary General was here, I think he just left, right? And WMO Secretary is not here. Maybe yesterday we heat stressed her a little bit too much. Now she's feeling the heat. But anyway, this was a message last year. We have entered into another phase, no longer warming, boiling now. And if that doesn't scare you, most recently, a couple more reports got rolled out. Important to create the urgency. But guys, we know, right? Knowledge and attitudes do not always translate to action. So we keep on emphasizing the last bits. What must it take to trigger actions? From a policy-maker perspective, is it economics? Is it societal pressure? Then all the way to that farmer's perspective, see it from their lens. You could go and say that if you don't do this, right, the health risk is going to increase. Likely they will look at you politely and smile, say, young man, if I don't do this, no, it's not risk, I'll bring less bread home. So I understand the impact assessment that you guys did, right? But I will take the risk and work equally hard. So see it from their perspective, not just see it from our perspective. In our part of the world, this is what we are experiencing, not just heat, not just humidity. It's all year round. Tell me one day you wake up in this part of the world, that you feel that it's very cold. Not many parts in this region. In Singapore, definitely not. So we are already being compromised for the longest time. We are nearing the threshold, and therefore that 1 degree, 1.5 degrees, 2. By the way, that's mean. It means that in real, there could be days that fluctuate a little bit more. It will hit us a little bit more. So it's not as if that heat is a new issue. It's not just humidity is a new issue. We have been in that situation for a long, long time. If I face the camera right now to you and take a family portrait, right, this will depict us. We seem to be happy, being soaked in this warm water, being cooked very slowly. And this next video best depicts us. I always say the best analogy to describe us is we are the boiling frogs.
We are being cooked very slowly, and we are not even aware that we are being cooked. This year, we hit a 40-year record at 37 degrees Celsius. And bear in mind, in our context, it's not just about a high temperature, it's also about the high humidity. It is a problem that everyone will feel in the broader society. It's not climate change, it's climate crisis because we are right in the midst of it.
My name is Charles, and I'm a full-time food delivery rider. Every day I work for about 10 to 12 hours. So under the sun, every day, non-stop. During really hot days, it's really tiring. So after work, I don't really have the energy to spend time with my kids.
As we near the thresholds of human limits, any small increase makes a difference because at some point you can no longer lose the heat that you produce. Our leeway is getting tighter and tighter. And being in Singapore, I'm very proud that we are always proactive. No, we do not want to wait when that 40 degrees Celsius comes and then we ask ourselves, what should we do? The Heat Resilience and Performance Center is where we want to partner the best in class locally, regionally and globally to undertake research and innovations to augment heat resilience, profiling different populations to understand their vulnerability. So using science and technology, we'll be able to quantify core temperature continuously in real time. Doing so, we can understand the impacts. We can also prescribe very targeted solutions to reduce heat strain. We harness an array of techniques. For example, we use the ingestible temperature capsule. You can swallow it the day before or the morning if your profiling commences at night. That allows us to capture thermal strain continuously, incorporate with heart rates, that is a measure of cardiovascular strain. Put the two together, you get an overall physiological strain. In tandem, we also put on a watch and there was an eye button, and that allows us to look at their skin temperature. In terms of real-time monitoring, we also want to build algorithms so that we can estimate heat strain non-invasively, and then very targeted solutions can be recommended. This job of delivery is of concern. You have factors that will result in a high heat strain or a hot body that we want to avoid. The impacts are impaired decision making. You might make a mistake and therefore accidents will happen. For Charles, moving ahead, I think we should have a sensor that when it crosses a certain threshold, there could be alerts sent to the rider and say you probably have to take more rest, hydrate yourself before you get overheated.
Method to advise riders how to reduce heat inside them is a good thing for us.
That is how we envisage as we move forward. Don't assume a one-size-fits-all. You must have a very targeted approach. And therefore, often behaviorally, right, they will disregard the increase in environmental stress because they are there to learn. So they often differentiate. So it's wrong to assume.
A good example would be people with hypertension, maybe on beta blockers. And these are a group of medication that may potentially affect the capacity of the individual to sweat. And in diabetes patients, their ability to drink water in response to dehydration can be affected. And because of that, they can easily get dehydrated. And that state itself put them at risk for heat-related injuries.
Solutions could be very creative. A future mobile cooling center during periods of high heat stress. So let's tackle the problem upstream and not just be reactive. What we are doing here, a large part is the adaptation arms. We are buying time with these adaptation tools and solutions, pushing the boundary, right? Humans still need to survive right now, and that is essentially the mandate of what we are doing here. How come I'm getting it? 50, it's pretty high. Yeah. It's not good just to live a life. We want them to enjoy their work out there. Solutions take time, but I'm an optimist. With science and technology, that is where we should push the boundary to augment heat resilience. And this is especially important in a warming world that we are experiencing.
Okay, if I may add, not just science and technology, but true trusted partnership. I think that is the essence of why we are gathering for these next few days. British Medical Journal, a very reputable academic journal, tried to document the less discussed impacts, and they call it underneath the iceberg. So there are more things beyond just the usual mortality. Our team took it a step and tried to quantify other less described, sometimes indirect impact of extreme heat. Some of these outcomes should be more relevant in our context. A couple that I always use as example, we sort of take it as a way of life that nobody commutes to work by walking or cycling in this part of the world. If you do that, either you are an expat or you are crazy. Yeah, but that is something we have lost and we have given in, say no chance, the infra is bad, the weather make it worse, so no chance. So your activity count, 10,000 steps, 50,000 are all intentional. You lay into that Asian mentality, you are workaholics, so unlikely you have time in the morning or in the evening to exercise. Add those together means you are physically very inactive. How about eye health? Myopia, do you know lack of outdoor exposure, not just vitamin D and cause all your mental issues? Eye is also being affected. You say, eye, don't worry, we have hard lens, we have contact lens, we have LASIK. Imagine you are a parent of a young child, I say that 10-year-old, one of the eyes or two eyes of your kid is already degraded at the onset of life. Would you accept that? You are accepting that. If I say that that's likewise to your kidney, you say, no way, how can my kidney be malfunctioning so young? So see, things that are actually not normal, we have taken that it's normal. And as a population, you have eye disease at onset, myopia, then there's a greater chance of health burden subsequently. And those are just a couple of examples. Mental health. Now we see mental health as another big ticket item. If you don't exercise enough, trust me, the risk of mental health will increase. Therefore, before the pandemic, we say keep yourself fit, right? For general health. During the pandemic, we say keep yourself fit to fight COVID. Post-pandemic, in face of a warming world, we are not being too demanding. We're just asking you to do the same thing. Keep yourself fit, get outdoor. So there's also space for us to see whether we can use heat maybe as a eustress and not always a distress. We have positioned heat as a bad boy. After all, it is a stressor. You heard about this term called heat acclimatization. Essentially, we are using heat in the right manner, right dosage frequency, and make you stronger. I always candidly say if tomorrow we publish a big paper, say that 3 exposures per week over a month of outdoor sun, noon, make you more beautiful and handsome, trust me. Next morning, afternoon, you see, this group of young people or whoever will just get out there and say, wow, I saw the report. We want to use that as a eustress and not a distress. Okay, there's a lot I can elaborate, but I hope this slide you can help to chip in. If you look at this from an economic, from a societal perspective, quantify it, you will conclude that we are being compromised in many ways that we are less sensitive to. But the group I want to focus amongst all the segments, right, could be heat on males' fertility, maternal health, children's learning in school, occupational sectors, farmers, law enforcers, soldiers, firefighters, elderly in our part of the world, a super aging society. So likewise, like it or not, climate change is the issue of inequality, right? The most vulnerable will be hit most. So if you are old and weak, with the same stressor, relatively, it will hit you more, and therefore expect that kind of, in Singapore, likewise, we are anticipating that. Likewise, as your population age, right, see another stressor called heat is going to cause more harm on that. But across these sectors here, I want to focus in view of time on one sector very close to my team's heart, that is the construction workers. Do it in many reasons. One reason I hope we'll do it is really these workers in our context work hard so that we Singaporeans live in comfort. And therefore, that is a group we want to focus a lot more. So in Project Hit Safe, it is a multi-agency, multi-institute, local, overseas. We came together and tried to look at a problem from multiple lenses, not just from a physiological perspective, from a climate, medical, engineer, epidemiological, social, and try to provide a solution that covers as many gaps as possible. So these are the three usual outcomes that trigger conversation from an occupational setting. Prevention of heat injury, of course, is number one. But in my experience, the chairman will say that, yes, it happens as collectively, but in my company, no heat injury. Thank you, Jason. Our conversation stopped there. I said, not so good. How about do something so that your productivity can be enhanced? Usually, that will trigger a few more conversations, but in my experience, they say, no, we profit enough, so we know in face of a warming world, we probably will profit a little bit lesser, but it's okay. I know it's a conversation of whether I profit 10 million or 9 million, I lose 1 million, I'm still profiting. Conversation stop. I personally find the third bubble in this context take the conversation much further. That is heat-induced decision-making leading to accidents. Usually in the system, there will be an external party looking at this. Auditors will come in. So you will trigger more action, say, no, we can't afford that. Accidents, work might stop. Huge implications. So see which angle to attack, and it must be unique in different contexts. So it's all about context in our work. Likewise, right, you buy a property, they always say it's all location. In our case, it's context. This depicts the various places that we went to undertake this work. Singapore, Cambodia, Vietnam, even South Korea. In lieu of time, I just want to focus on the center photo here because in that condition, dry bulb's temperature was about 20 degrees Celsius. Moderate humidity. That to us is winter in Southeast Asia. Most comfortable. But guess what? Which group of humans was the hottest? It was the one in the center. Delivery men. My main point here is do not assume a hot environment always equates to hot humans. Journalists like to ask, what is that magical threshold above which is beyond human survivability? It's a very dangerous question. I try to avoid answering because it might accidentally wrongly educate others that if anything below that threshold, it is safe. It is not true. After all, we are worried about hot human being. Environment is one of the key inputs. It works very well when the other two inputs like attire, your work physiology are pretty much constant. Then you can make a good assumption a hot environment equates to a hot human being. Typically play out in a classic heat stroke, summer heat waves. The very young, the very old get compromised. The majority of us will fall in the middle group. A lot of time, the main input is how hard you are working, and it's a function of your paying model. So it's quite complex. If you are paid a fixed salary, then why should you work very hard when it's very hot? I will just stay there as long as possible. I'll get the same amount when 6 p.m. comes. If I'm a delivery man or woman, I will work very hard, even it get very hot, because I need to bring the bread home. Therefore, the behavioral part, the sociology, the implemented sciences consideration, all must be taken care into. No time to share the results, but I want to share this outcome. Super proud, because this exactly must be our motivation, not research for research's sake. We understood the issues, a lot of conversations with the stakeholders, get the findings published for scientific peer review, make sure that the community agree, not just what we think the science is right. Then close the loop by affecting the policy if there's space for it. After the policy is being rolled out, I'm very glad locally the ministry responsible for this area of work is Ministry of Manpower, abbreviated MOM. Beautiful name, MOM. Nobody loves us more than our mom, So in this case, for the laborers, for the workers, right? Besides other reasons, these societal reasons of taking care of these workers who build the nation must be there. In some countries, it's called MOL, Ministry of Labor, right? But they should consider renaming it to Ministry of Love. Yeah? Keep the L, but could be love, yeah? But it's important. Recently, MOM closed the loop policy rolled out. They went out and audit and found that 1/3 were still not complying. It's okay. No, don't straight away take out the stick and say, let's whack them. No, I still think there is space to augment this remaining 30%. My working hypothesis is there's still some chairmen who are still assuming more rest, more measures must be bad business. I'll prove to you that's not the case. If we can eradicate that concept, more rest being bad business, right, I think we can close up this gap. Okay? I just want to share that it's not just about hit on productivity, on injury, right? In this case, it was quite classic. We found that in a group of healthcare workers, when they were thermally uncomfortable, them serving as their own control, counterbalance, intervention was the ingestion of ice slushy. Not the one you get in 7-Eleven, yeah? The composition is, or rather the solution is high in sugar, so don't use that as a solution, but put any isotonic sports drink into the same machine, it makes very good ice slushy. Anyway, we used that, cool them down, and found that when they were cooled, they took less risk. So this might be one explanation why during hot days, many aggression, decision makings are being compromised. Humans tend to take more risks. Maybe too hot, too cold, too smelly, too noisy. The default action is I want to get my job done and get out of here. And there, in the process, can induce wrong decision. We tested out various interventions in Project HitSafe, education. We gave more breaks, and then we also look at their attire. And what we found, as a group, most of them had their productivity improved post-intervention. Remember, one of the interventions was more rest. In this case, more rest resulted in more individuals worked more when we measure them quantitatively. We're in the midst of closing the loop, not just looking at the occupational heat stress in partnership with UC Berkeley. We're looking now at the resting conditions. Your life is not just work, right? As when you get back to the dormitories, what are their living conditions like? So we're in the midst of exploring sustainable ways. Aircon is definitely out of the conversation. How we can design ventilation using fans, to augment thermal comfort. So to sum up, tonight I call for collaboration. We set out the center not to undertake work just for the nation, but to pull together regional partners like you. So together we can co-create. If you say, what is, have you set out the roadmap? It's always going to be a work in progress. We invite everyone to be part of the process. So we have organized ourselves in broadly 3 teams to discover new mechanisms, to have a strong surveillance epidemiological database, so we can baseline and see where the signals for us to probe into. We are looking at technology, from building sensor to sense making. If you put out a heart rate monitor, when should we pull this guy out? Likely it will be personalized. Is 150 beats for him too high or too low? That's the sense making part. And of course, we want to strengthen. We already have a good suite of heat management plan. Condition yourself, heat acclimatization, optimize your work rest cycle, pre-cool, per-cool, post-cool, and hydrate properly. There are more. That's where the assignments of using science and technology, using the right technology. But before you introduce new ones, there are established ones for you to try out. So if you're keen, we can have a conversation. Working with Singapore Management University, led by Prof. Winston Chow and co-PI from NTU, Perrin, collectively, my group is responsible looking at the physiology, but we are also finding ways how each of our sub-expertise can be combined. In this case, we are trying to look at the physiological responses of 3 groups. Very young children, unacclimatized adults. Some of you will fall into that category. If you stay long enough in Singapore, please sign up for our trial. We are looking for unheat acclimatized tourists. And finally, the elderly, looking at their physiological response in the same environment. Control, warm, and very hot. And then finally, working with partners in Singapore University Technology and Design, SUTD. There we are looking about more from a social perspective. As I said at the start, knowledge, attitudes don't always translate to practices. What is the mismatch there? What is the dissonance there? Yeah, so if I do a poll right now, who believe in climate change, I think most of you will raise out your hand. If I say who will do something towards climate change, I hope most hands will be raised, but in real, not many of us are doing something. So why? Is it because there is no stick or carrots? That's something we want to uncover here. Finally, I'm very glad the government has also sponsored a new capability. Prospectively, we want to look at both heat and pollutants in tandem. Laboratory setting allow us to understand the mechanisms. We are doing a lot of field observations, but fuse that together, I think the insights will be more targeted because each has its own strength. You can never study behavior, which is a huge component in the lab, but you cannot study detailed mechanisms out in the field because it's too noisy. You don't know which is what. So fuse together is our intent. And with that, I call that we use this new platform, the Southeast Asia Heat Health Hub. We have changed Node to Hub. Right? It's part of a global heat health information network. We could start this initiative. First forum will be up. Next slide, I will show you. This is another platform for us to convince to talk about heat-related issues that touches our heart, relevance to this part of the world. Remember, we cannot just cut and paste. We need to first define our problems in our context, and therefore the solutioning can be more targeted. So keep a lookout as we advertise this upcoming forum, 7 to 10 January 2025. I thank you, I thank my team, and I'm happy to take any questions. Thank you.
Thank you, Professor Jason Lee. So we'll now open the floor to questions. Any questions from anyone in the room? Feel free to go up to the mics. If not, we will do the questions online. We'll start with the first question on how humans can adapt to these extreme conditions. The one on the right.
Yeah. Humans can definitely adapt physiologically and behaviorally. But there's only how much we can adapt if you keep on lifting the requirements. You say today we hit 35 degrees wet bulb, that's often known as the harshest or the threshold. Then no matter how you prepare yourself physically and behaviorally, you can't deal with that environment. Yeah, so there's but that having said, it doesn't mean you shouldn't, right? You should, because the good thing about getting heat acclimatized and getting physiologically trained, right, the outcomes are quite similar. You have an expansion in blood volume, increase your sweating, skin blood flow, and those are all very good health markers. Do you know today, let alone this heat issue here, people are using heat as a therapy to augment health. Or just by soaking yourself in onsen 3 times a week, if you're in Japan, very popular. But be careful, I was told that you do that at home in Japan is very dangerous. The stats showing that 5,000 get killed every year performing that at home. So do that in public facility when they are first aiders. Don't do it at home. Don't try it. Yeah, so you can, in short, but there's not how much you can adapt physiologically.
Thank you. How about the next question on how do we quantify the impacts from heat stress?
I listed a few. I hope you can contribute to that slide. Each of those is worthy to be further quantified from an economic perspective, from a societal. Not everything must be quantified from a monetary sense. Right? That can also be dangerous. Don't always say, no, I cannot quantify how many millions or billions, means that is not important. Some things are very hard to quantify, but equally or more important. Also from a societal perspective, from an economic perspective, that aggression, does that translate to more accidents? I can have the numbers, put them into the economy lens. But just having a community thermally uncomfortable, quarreling, don't feel that all the infra the government has built has done them good because nobody used the walkway or parks. That is not good. We should do something about it. So quantified from multiple lenses, the more outcomes likely, based on math, right, should have larger implication. Put them all together, it is not a problem. I like to campaign that it is a big issue here. In Singapore, I say maybe be all the infra healthcare system we can build. But if Singaporeans or humans don't walk in Singapore, your healthcare burdens will continue to rise. So I'm, of course, biased. I say if you relieve that thermal discomfort, people here will walk more, and therefore health burdens will be reduced accordingly. Heat, after all, is a key or a major influencer to the tenets of human well-being, how you eat, how you exercise, and how you sleep. Heat suppress exercise, heat compromise sleep. Heat also suppress eating. Southeast Asian, hot and humid. The stunting issues could also be linked that we don't eat particularly well. Of course, not the only reason, but it's another reason why we are not eating as well. Thank you.
Thank you, Professor Jason. So we have our last talk before the coffee break. That will be Dr. John Nairn, Managing Director at Climate Extremes Consulting and also former Senior Advisor on Extreme Heat to WMO. With a 40-year career in the Australian Bureau of Meteorology, Dr. Nairn's scope of work spanned tropical to Antarctic climate zones. Dr. Nairn will be giving us a presentation on how to utilize climate services to support the management of climate-related health risks. Dr. Nairn, please.
So thank you. I see we've hit afternoon tea time. First of all, thank you very much for the invitation to present here. It's a real privilege, and I'm very grateful for the speakers that spoke before my session because they've covered a lot of the issues in terms of need, and so I'm really grateful for that, and they're excellent presentations. During my time in the WMO, I classed myself as the double spy. I'm actually an operational meteorologist through my career, so working forecasting bench, but made it up to the executive. But there I was working in the health unit within the WMO, worse yet, answerable to climate services when I'm a forecaster. So I was there to disrupt the system to some degree, and so I'll show you some of those issues that I've discovered while I was there. So my outline is to, first of all, lay out some of the WMO issues around also the WHO, climate and health, how that related to CIRCOM activities and early warnings for all. But also I'll address extreme heat standards and a handbook that was being developed that should be an aid to the community, which will address issues around climate, thermal and intensity when related to extreme heat. Then I'd like to also address the issue of heat wave as a weather phenomenon, which is not, it's relatively new. And I might pause there and say, we have to have a reality check around heat wave or extreme heat in that it's not as mature a science as the rest of the work that we do within the meteorological community. And we mustn't go forward with the assumption that it's been worked out and that it's there just to be handed over. We're still working out how best to address extreme heat. It's a relatively new, rapidly increasing hazard, and we have to work out how to address it properly. So, and if we take the intensity focus through as we would for any other weather phenomenon, we will be able to address impact-based forecast and warnings, apply our severe weather phenomena approach, the multi-hazard early warning systems, and also look at how we can do CAP, do the appropriate warnings, systems that will get our information shared appropriately. And then I'd like to finish with the collaborative process and opportunities. Although I think Julie Tatan covered that in a really excellent way earlier, I'll be brief. So it's vitally important to recognise that heat wave mortality, which when we look at our data collaborators in the health sector, it's very hard to get that data collected. There has been addressed recently through some research, which is establishing that the toll is probably 30 times higher than we report. So if you look at the impact measures that we use within the WMO, the report will always be below the actual impact level. So we saw a diagram earlier, I think it was Ben's presentation. We don't have that data within the WMO, so it's going to go through underreported. We know that there's roughly 500,000 people excess deaths per year over the last 20 years the WHO has established that. and that it's disproportionately affecting the less developed countries, and that we have a poor pickup by the health industry of the available climate data. So it's really important that we address that. It's also becoming very apparent from all the speakers you've listened to. It's an all of society problem, so I won't dwell on that for long. But if we make the mistake of only looking at health and its needs to address the health problem, we're going to make a mistake. Because health is impacted by the environmental degradation, health is impacted by infrastructure failures or degradation of infrastructure. So we must look at it like we would for any other weather phenomena, that the service that we provide is available to all sectors to address heat, not just targeting health alone. We should look at all sectors and how our service can meet those needs. This diagram doesn't need much time spent on it. I'm sure lots of people have seen it before, but it's the need to address the seamlessness in time, both in, I've added the climate and real-time analysis component part. What we learn from the past is what then will enable us to go forward and address the rest of the diagram. So the climate data, climate of hazard, not just our climate indicators, the measurements that we take, but the climate of the hazard becomes extraordinarily important to our partners. So we need to be able to work on the hazard climatology, and it will affect all the sectors. So in CERCOM we had, and I'm actually probably going to gloss through this because you'll be able to read it later, but we were asked to address the state of I was asked to look at the state of heatwave warning systems. Absolutely impossible to do, because heatwave has been used under all the different interpretations of who needs the service. So there's all these different ways of looking at heatwave, so you don't have a uniform approach to heatwave. So it's extreme heat. I've bundled it together and I'll disaggregate it for you shortly. So then you can look at the components of an extreme heat service, and we then get standards that will allow us to progress the science and progress the partnerships in a really methodical way. So we've written, we've looked for evidence, we've in the process of updating the guidance for heatwave warning systems. We formulated a task team to look at a handbook for extreme heat indicators and indices as that guide. Worked with the UNDR and WMO Centre of Excellence, where heat governance came up. That's where we actually did a study with the G7 where they identified great progress in heat health systems, and then a contraction in scores because the governance issues weren't being addressed. So that's something else you can consider. Regional consultations, which include our opportunity here, and then writing a heatwave, extreme heat roadmap and what we need to do to achieve it. So the standards, this is a map that a student has worked here with Jason to develop an inquiry into all the different methodologies being used for heat wave systems. To be honest, there are so many different definitions and approaches summarised there. You'll understand that there is no standard for heat wave, and it makes a huge problem for doing heat wave warning services as a global approach. And there are answers we can look at, and even within this part of the world where you have quite diverse climate regimes, we will have a bit of a problem, but we can definitely address it. So characterising heat waves, no. Characterising extreme heat is the question we need to actually look at for the Met services. So we have approaches where, if you like, the first one, characterising extreme dry bulb temperature, has been an approach to looking at heat wave. It doesn't describe heat waves, people. It describes the temperature extremes. So it's a different service. It's actually not looking at the heat component. And if I were to characterise that briefly, because it's the heat wave intensity at the bottom there, it's actually how high the temperature is throughout a day, over a sequence of days, and how poorly you may be discharging that heat through the recovery period of overnight. So it becomes an energy problem rather than a Kelvin problem. So we have to adjust ourselves to understanding what heat wave intensity is if we want to do heat wave. The other approach, of course, and these are all complementary, so then none of them says there's a winner. Possibly the human thermoregulation, a la Jason's work, the thermal heat stress question is highly appropriate in places like Singapore, where you have high persistent temperatures and humidity, but for much of the rest of the world, you may well take the intensity approach. So we look at that. But we need to have the ability to separate these disciplines to be able to develop our science appropriately and get the right services in place. So if I look at examples where we're doing those different things, the Argentine Met Service has done a lot of work in temperature, for instance, as an example. And to make it possible to make that work as well as it can, they've done a lot of epidemiological evidence gathering and testing of those temperature thresholds that they use. Singapore, of course, we know about the thermal wet bulb globe temperature approach, entirely appropriate for this part of the world. In Australia and the United States, there's the emergent approach to intensity. In Australia, it's an intensity severity paradigm where, if you like, there's a single combination of maximum and minimum temperature to help to capture that sense of the intensity over a period of days. I can't go into the methodology, not enough time, but there's different ways of doing this. But it's worth noting in terms of what we've done in Australia, we managed to do the epidemiological work collaboratively with our partners, with university sector support. And one of my learnings in doing this was to publish in the health journals with them and getting my partners to publish with me in the meteorological journals. That process has actually elevated the conversations with our partners in health and emergency services, and we ended up with the ministers at all levels of government signing off on a national heatwave warning service. So it's one of the collaboration piece is extraordinarily important to take it forward as per Julie's work. So if we move on to heatwave as a weather phenomena, the diagram I've drawn there is the tail of a distribution function which would describe temperature for any location. I use extreme value theory. This is the snip off. It's a point over threshold. Above that threshold, I'm interested in what's happening in the extremes. So it's extremes statistics that I need to work on heat wave, extreme temperatures. It's similar to what you would look at in terms of, say, any other weather phenomena, such as wind or rain. You're going to frequently see low intensity events, the first part. Most of the events that occur are low intensity, and less frequently you will see the more intense events. It's a very common sense approach to understanding how you would deal with a weather phenomenon. Yet we don't do it for heatwave. In heatwave, we'll pick a threshold where we've taken a number, so we're sampling the population and looking at a threshold approach to saying no heatwave, no information when we're saying no heatwave, and then a warning. Or pick off another threshold and say a more enhanced warning. But there's so much that's happening below the warning level where we have low intensity events, and many, many other users have use of that information, which we deny them when we don't supply the intensity information. And what's really important in the health community is they're now telling us that most of the health impact occurs in the low intensity events, in the chronic heat, here. Yes, you're getting the rare, really extreme events, but they're less frequent, so therefore, yes, you see the numbers turn up and the people being impacted, and you get all the headlines, but most of the effect is in the lower intensity events because they occur much more frequently. So why wouldn't we share that information with our communities who can use it, do the studies with them so they can demonstrate the efficacy of our techniques and therefore build a full service that gets people using, no matter what sector they come from, energy, transport, health. If you do an intensity approach to your service, it's the same as you do for any other part of your climate and weather services. So intensity approach sits side by side with the human thermal question that you would supply that service? Absolutely. For your exposed people who have particular needs. But also it sits next to your standard climate services because guess what? You supply those climate services day in, day out. It contextualises the event for your communities. They know how to use that information on a daily basis. So you need to have all three elements. So the severe weather paradigm is missing currently if you don't use the intensity approach. It allows the community's capacity to manage the lower intensity events to be recognised. We do it with everything else we do. Why wouldn't we do that? It serves more sectors, but it is inclusive of health. So it can be a first responders. And the other thing about the intensity approach is that it actually has the ability to go out further in time than we might do for the thermal approaches because humidity is that very challenging parameter to forecast out into the distance. So there's many aspects to this. Yeah, okay, I've covered it. And there's a huge demand from the international community for the HIPS, the Hazard Identification Profile, and we need to standardise on a measure of heat wave so that they can begin to record globally the impacts and understand whether we're improving or not. So for heat waves, they're all local. They're a question of cumulative excess heat, not just the temperature won't get you there on its own. You have to be able to parameterise heat somehow. It's a sequence of days and nights and unusually high temperatures. So that linkage between heat and temperature is there, but we must think about heat waves in that manner. I have included a slide that I'd rather people not capture this slide and use elsewhere. I've included it. I should put a draft. But this is data from Hong Kong Observatory that they've allowed me to look at. I'm showing you the work that we have applied in Australia, applied to Hong Kong, where you can see heat wave intensity and its level of severity. And when I showed you the distribution curve, where the 85th percentile was the inflection point for low intensity heat waves, that's the orange line there. So the low intensity heat waves are the frequently occurring heat waves. The severe ones are the warning threshold, where we know that there is mortality over 65-year-olds in Australia. So that's our national standard. But it gives you a clue as to how we are changing in time using an intensity-based approach. So this will struggle in Singapore, I know it, but as soon as you move out of the wet tropic zone, it'll work better. Interestingly enough, in the maritime region of the Caribbean, they're beginning to see this signature because the minimum temperature has risen so strongly. So you may yet find some utility as the climate changes. And last of all, so there is this need to understand that these are all complementary components of an extreme heat service. Looking at the temperature climate indicators, which is standard work for climate as we know it, and it has skill in the seasonal and short-term and climate record, thermal, The physiology ones, it's shorter term because of the forecasting ability for humidity, but the intensity severity approach, and these have been captured in the a handbook, forthcoming WMO handbook on extreme heat indicators, indices and metrics that we have got prepared for the WMO to consider. And so the quick recap, I'll let you read that later because of time, but we have a lot of members providing temperature data, but it has proven not to be particularly useful for doing impact-based forecast and warnings because of the intense nature of processing impact data. But I'll let you read that later. It's what I've done. So the collaborative opportunities, I've drawn this diagram. This might be a diagram for the cafe where we could actually explore this further, that those would like to come. So as a promotion, I'll let you know now, I don't have the resources that Jason had, but I have brought Tim Tams. So I invite you to come. But if we were looking at what health does, when they look at impact and the climate record, they will go to a hazard climate data set, and we've already been told that they will frequently create that data set themselves or source it from reanalyses or things like that, things that we know will not be quite good enough, but they will do that, and they'll have their health outcome data, their impact data, and then they've got their policy for risk. They'll do their dose response epidemiology, they'll come up with a hazard impact function, they'll establish on the risk a threshold that they will want to then do their warnings on, right? And if I look at the other side of the equation, if we are just a hazard-based organisation, meteorological services, the Met Service will have a hazard weather forecast. We'll also have some context from our climate data. We will supply multi-sector hazard forecast. It's for everyone. We'll establish a severity threshold. It'll be based on the climatology. And then we'll have a hazard warning. These two things can exist in isolation or they can exist in combination. And it will only happen if our data custodians work together. And it means that we sit together for a length of time, understanding the challenges we have in each other's data sets, in our own data sets, and we work out how to make it work together. So it will not work in isolation. And when we do that, the collaboration piece in the middle will still do the same work. But what we'll actually end up with is not only the health impact-based warning, it will be coordinated with the multi-sector impact aware hazard warning. They'll go off together. There is a great danger at the moment that the health community in many of the locations across Southeast Asia are going to go it alone. And will they be coordinated with our data, with our understanding of the hazard? We must work together to make it effective. And it was almost my last slide. How can we collaborate? Obviously, the health outcomes are readily available data in some respects. You have other sectors with impacts, but it's a challenge to help get them to come forward and work together with their data. Often, power industry, it's often commercial in confidence, so it's very hard to get some forms of data. In Australia, the emergency management sector are responsible to government for all other sectors across the economy, and health is out there on its own. That's part of the governance issue. If health is left on their own handling heat, they don't have the reach back that the emergency services have. We're actually a very, very key part to how we can bring health into that emergency services relationship and get them the governance they need to work better. So we're a key partner. The extreme heat climatologies are extraordinarily important, whether they are in climate data, thermal data, or intensity data. And we talk to our partners about how they might use which one or more. The epidemiology with our obviously health sector, but often the universities, is very important. And finally, I add where I started with coronial data. Event-based, where you have the big extreme events, they can be a pull-through to get you started, because the coroner will hold the interesting data and you will hold the event data, and the epidemiologists don't go near it because they look in big data sets, whereas an event is a small data set. So my first publication in extreme heat was the 2009 extreme heat wave in Adelaide in South Australia, and my partners won multiple awards for collaboration, and we got into their journals. So it's a great way to start. So I recommend it. Summary, we've got CERCOM and early warnings for all. Early warnings for all, the recommendation is to do intensity. It will serve most of the globe well, but there will be small variations, and I think of Singapore as being a great example. We've got the handbook, which I hope we can get out. Come and speak to me about the handbook if you wish. I'm no longer WMO, so I can help people with what I understand is the difference. And I have a consultancy. And there's the weather phenomena concept, which I think we should be exploiting rigorously, and the collaborative opportunities, as my previous esteemed speakers have mentioned. I think they're excellent. So thank you very much.
Thank you, Dr. Nairn. So we are opening up the floor to questions again. If not, we have a question online. Which are the sectors or countries that will find a heat wave intensity index the most useful? And have they started using this index?
So I'm extremely unbiased as the Australian in the room, having built the extreme heat wave warning system, but it is a severity system. It uses extreme value theory to capture the frequency of return periods for the levels of intensity, and it has been tested against health data to demonstrate its efficacy. So yes, the United States has been moving away from the climatic threshold approach to an intensity approach. And I think the Swiss have merits in some of their system that is moving more towards intensity-based. It is extremely new. It's extremely different way of thinking. But I stress again, there's our climate approach to indicators, such as temperature. There is the thermal approach, which is around human heat budget approaches, wet bulb globe or UTCI. And then there is environmental heat budget, such as heat wave intensity, which you can then classify into impact thresholds through severity, which is using extreme value theory. So that's it. Yeah.
Thank you.